Let's now talk about diagnosis according to Zhang-Fu organ patterns, urinary bladder imbalances, part 2. The dampness can be combined with cold or heat. If there is cold present, it will further block the urinary bladder's Qi mechanism and burdens the kidney's yang aspect, which will hamper the transformation and transportation of fluids. Due to its contracting nature, cold can cause problems with voiding the urine as well as difficulties in emptying the urinary bladder completely. The dampness and accumulation of fluids can result in the person's having no thirst. Heat can also combine with dampness. When there is heat, it can boil the urine so that the urine is dark, concentrated, and odorous. In contrast to cold, heat has an expansive nature and creates overactivity. Heat can therefore force the urine out of the urinary bladder. There will then be a frequent urge to urinate, but because the heat has evaporated and condensed the urine, there will only be small quantities of dark urine. This will further exacerbated by the dampness, which will in itself block the urination. Besides difficult and frequent urination, heat will typically also manifest with a stinging and burning pain upon urination. The heat can also cause the vessels to burst, so there can be a visible blood in the urine. Heat can also result in fever and increased thirst. Although there is thirst, the damp aspect and the accumulation of fluids in the body can mean that there is no desire to drink. This is characteristic of damp heat conditions. Damp is yin in nature and sips downwards. Therefore, when there is dampness, there can be a heavy sinking sensation in the lower jaw. This is most characteristic when there is damp cold. The expansive nature of heat means that urinary bladder damp heat has a tendency to manifest with tension or distension in the lower jaw, especially in the area just above the pubic bone. This can be a subjective sensation or something that can be felt on palpation. Damp can be both exogenous or internally generated. Internally generated dampness is usually the result of spleen and kidney deficiency patterns or excessive consumption of food and beverages that produce dampness. Exogenous damp, like cold, can invade the body when the person has been exposed to climatic cold and dampness. Dampness can invade directly through the skin, typically when the person has worn inadequate or wet clothing, for example, a wet bathing costume. Damp and cold can also enter the body by the yin channels in the legs. Damp heat can arise in several ways. Damp cold will typically transform into damp heat. This process is accelerated if there is already heat present in the body. Damp heat can also be caused by the excessive consumption of food and beverages that directly create damp heat. For example, alcohol and fried food. Damp heat can invade the body from the exterior. This may be due to exogenous pathogenic qi invading the body by the mucous membranes, that is bacterial infection in the Western medicine terminology. Heat can also be caused by emotional imbalances. There is a connection from the heart by the small intestine channel to the urinary bladder. The urinary bladder also has a divergent channel that connects to the heart. Heart far can therefore be transmitted to the urinary bladder, where it will combine with dampness, resulting in the urinary bladder damp heat. Emotional imbalances that affect the liver can also interfere with the urinary bladder. This is because the liver channel passes around the urethra and urinary bladder. Invasions of exogenous pathogenic qi can disrupt the functioning of the lung so that it does not send fluids down to the urinary bladder. These fluids will accumulate in the body's tissue and there will be a lack of fluids in the urinary bladder. This will result in acute edema and concurrent inhibited urination. The general symptoms and signs of urinary bladder imbalances are as follows. Urinary difficulties, that is, problems with voiding, frequent or urgent urination, incontinence, and painful urination. Cloudy, pale, or dark urine, increased or decreased volume of urine, distension, tightness, or pain in the area above the pubic bone. Thank you for your attention.